Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs.
Emily is joining us for this presentation today. So if you have any questions, feel free to put them in the chat and we will answer them at the end. Thank you everyone for joining us. And Emily, I'm turning the floor over to you.
All right, thank you for having me today. Can you hear me okay?
Yes, we can.
Okay, perfect. So today I'm going to talk to you all about supplements and your health. I know a lot of times throughout our health journey, you may have questions about if you need supplements, what kind of supplements are best for you. So that a lot of questions surrounding that, and there's a lot of information out there being given about dietary supplements. So we're just going to chat a little bit about that today, discuss what they are, and maybe some indications of when you might need supplements. One second. Whoops. Sorry. Okay, so like I mentioned, we're going to define what a supplement is. We'll look at indications and appropriate uses for supplements, understand supplement regulation and policy, and then understand the importance of a whole foods plant-based diet to help meet all of your nutrient needs. So how all of that kind of comes together. So supplements, what are they? So in 1994, Congress defined the term dietary supplement in the Health and Education Act. They state that a dietary supplement is a product intended for ingestion that, among other requirements, contains a dietary ingredient intended to supplement a diet. They are not intended to prevent or treat disease. They have to be labeled as a dietary supplement or an equivalent. So whether that's a specific nutrient supplement or if it's an herbal supplement, the word supplement has to be there. They come in forms of pills, tablets, capsules, gummies, soft gels, liquids, powders, and supplements can even be added into foods. Just note, most common you will see pills, tablets, and gummies on the market, but those may not be the best absorbed in forms of micronutrients. So if you have to take a supplement, doing a capsule or soft gel or even the liquid or powder sometimes is better absorbed by your GI tract. So if you do have to take them, keep that in mind. Common supplements are going to be your vitamins and minerals, herbs or other botanical supplements. You can have amino acid supplements or other types, whether it's a concentrate or metabolite or a different extract or any dietary ingredient that could be listed. So under the Dietary Supplement Health and Education Act, the FDA does not have authority to approve dietary supplements before they are marketed. So basically, this is how it differs from a medication. So medications go through rigorous research and clinical trials before they're allowed to hit the market. Dietary supplements do not necessarily have to have that. There's not a lot of funding going into dietary supplement research. And so the FDA basically tells manufacturers they are responsible for what is in their dietary supplement, and they have to follow what we call the good manufacturing practices that help to ensure the identity, purity, quality, strength, and composition of dietary supplements. And so the FDA can go and enforce these regulations if a company makes a claim about a dietary supplement that's not true. And if people come forward and say, hey, this is marketed as this, but it doesn't do anything, or it does something completely opposite, they can look in and prosecute based off of that information, but they are not approving supplements before they hit the market. So they're just not highly regulated like a medication would be. When we talk about supplements, we want to look at people who are at risk for deficiencies or have a nutrient deficiency. Commonly, these are going to be your elderly population, anybody who's had history of gastrointestinal surgery, whether that's a resection of some sort, like a Whipple, or even bariatric surgery, esophagectomies. Anytime a part of your GI tract is missing, there's a high chance you're malabsorbing nutrients that you're ingesting. Also, people with irritable bowel disease, that can be an indicator for a malabsorption disorder. If you are unable to eat the correct amount of food and keep your weight up, you may be malnourished. And so that would be an indicator for needing a supplement. And then some medications that people take can lead to deficiencies. And there is, several examples out there, like some chemo medications, they can interfere with micronutrients like electrolytes. So that would be a reason why your doctor may say, hey, take magnesium, just as an example. Pregnant women are also just a group of people who are at risk for deficiency because they're growing, have tissue growth, burns, any trauma. You may be at risk for developing a micronutrient deficiency. It's important if you suspect deficiencies or if you've had any of these issues or indicators in your life, then you may want to have certain panels done to see if you're deficient. So like for vitamin D, B12, calcium, those are kind of common. Sometimes people will have their iron levels checked, zinc. So you can ask your doctor to test those if you feel that you meet any of these criteria and you've never had that discussed before. So multivitamins and mineral supplements were initially designed for individuals who cannot consume adequate nutrients in their diet and for those who need increased micronutrients. So like I mentioned earlier, people who have rapid tissue growth or an increased metabolic demand. So their body's just requiring more energy than what they're able to eat. Again, you're elderly, you're going to be at risk, so they may benefit from a general multivitamin. Anyone with a malabsorption disorder, a lot of times doctors will just say, hey, take a multivitamin, and that kind of helps cover a baseline. When you look for multivitamins, you really want to find one that's designed for your age, gender, and life stage. So examples would be a Centrum Silver or a prenatal if you're within childbearing age. They have different formulations for men. They have just general multivitamin that really anyone could take. They have some for kids. So it really just depends on what you need it for, because sometimes the nutrient levels can differ in those. And you want to make sure that you're choosing one that does not have levels that exceed the daily value range. So a lot of times, because they're not regulated, some manufacturers will just add in an astronomical amount of certain nutrients, and that's just not necessary. Especially if you're still eating an oral diet, you may not need one that has a lot in it. Some multivitamins leave out certain nutrients like iron, and then some contain different forms of certain nutrients, again, like iron. So you could have iron chelate versus another form of iron, and sometimes they're just not absorbed the same way and they can cause side effects. So it's important to know, oh, I didn't tolerate this type, maybe I tolerate this better. So you really just need to read the labels on the back of them to see what you're getting. When we look at vitamin D, so what does it do? First, it helps to promote absorption of calcium and phosphorus for healthy bones and teeth. So it plays a huge role in bone health. That's what it's mainly known for. It can also help regulate the nervous system and help with muscle contractions and growth. It helps with your body's communication between cells, so allowing your body to communicate together so it can work the correct way. It can help keep minerals in balance in the body. It can improve immune function and help reduce inflammation. So vitamin D plays a lot of different roles. We can get it from being outside in the sun because our skin naturally makes vitamin D. Other foods like cod, salmon, tuna, so your fatty fish, they're a good source of vitamin D. Orange juice is usually fortified with vitamin D, as well as milk. Certain yogurts may be fortified, and then other good sources would be beef liver, eggs, and sometimes cereals can have extra vitamin D. So if you're eating any of those things routinely, you're going to be getting some vitamin D. Vitamin D supplements come in two forms. You can have vitamin D2 and D3. Vitamin D3 has been thought to be a better absorbed version compared to D2, but they are perfectly absorbed the same way in the GI tract. So research kind of just says, D3 may be a little easier to digest and absorb versus D2, but generally most people absorb them the same way and get the same amount that they need. People who are at risk for vitamin D deficiency should have their levels checked routinely. I think it's common for most people to have a vitamin D lab checked yearly. So that's something just to kind of keep an eye out for when you do have like a primary care visit and you're having routine lab work done. The largest at-risk groups for vitamin D deficiency are people with limited sunlight exposure. Thought it was interesting that sunscreen can actually reduce vitamin D synthesis in our skin up to, I think, 90%. So, if you're outside a lot, but you're wearing a lot of sunscreen, your body just may not be making a lot of vitamin D, which is fine because we do want to prevent skin cancer and stuff like that. So it's important to wear sunscreen, but that's just a factor to consider when you're talking about vitamin D status. The elderly, people with kidney disease, and people who have poor gastrointestinal absorption could be at risk for vitamin D deficiency. When you get a deficiency, it can be an issue because it can lead to osteoporosis and osteomalacia because, like I mentioned earlier, vitamin D plays such a big role in bone health. It can cause your bones to become brittle, your teeth to become brittle, and they can crack and break easier. You can also feel more fatigued if you're low in vitamin D. A lot of people are actually borderline deficient. That just has to do with our Western society of being inside and, eating a American diet. We're just not getting great sources of vitamin D through food. So I think that's one reason why it's routinely checked. So we're going to look at vitamin B12 now. It's important to help with making red blood cells. It helps to promote cell metabolism and nerve function, and it also helps your body to make DNA. You can get it again through beef liver. Nutritional yeast is a great source, and then your fatty fish like your salmon, your tuna, eggs, cheese, yogurt, turkey. So mainly animal foods are going to be a good source of B12. You take B12 in multiple forms, like a multivitamin can have it. There's B complex supplements out there that contain a different array of B vitamins that will have a B12. You can have intramuscular injections, or you can take it sublingually like a dissolvable tablet. And most of the time when I've seen somebody on a B12, it's usually injections or the sublingual tablets that they're getting. People who are at risk are those with anemia. If you've been on any type of medication like metformin or a proton pump inhibitor like pantoprazole or omeprazole, you could be at risk for a B12 deficiency. Again, any GI malabsorption that's occurring can significantly impact B12 status. So if you've had a resection, especially anything dealing with your stomach, because that's where B12 is metabolized and absorbed, then you may be more at risk for a B12 deficiency. And then vegans, vegetarians, those people are at greater risk of a B12 deficiency because they're not eating the animal foods that I previously mentioned. And then the elderly. I think I actually had a B12 deficiency in college, just as a fun fact. I was following more of a vegetarian diet and didn't eat a lot of meat. And so I started to experience some of the side effects from having that deficiency, like neuropathy is one. And it was really interesting to me because I was like, what in the world is causing me to feel this way? Well, I had my B12 level checked and it was borderline low. So that was eye-opening for me and just really helped emphasize the importance of a well-rounded diet. And once I kind of got that back in check, a lot of those symptoms went away. My B12 has been fine ever since. But it can make you feel really weird if you're not getting enough B12. Iron's another supplement that is commonly recommended. It's responsible for making hemoglobin and myoglobin, which are components of blood, and that helps to carry oxygen to all different parts of your body and to your muscles. So it's very important to help keep your body oxygenated. So you need iron. When your iron's low, a lot of times you'll feel fatigued, you'll feel tired, just weak, not good. Iron is important in physical growth and neurological development. It helps with cell function and can help your body make some hormones that it needs. Good food sources of iron can come in both animals and plants. I did want to note again, mammal or animal sources of iron are better absorbed for humans because we are also mammals, and it's attached to that hemoglobin, which you're getting in the beef that you're eating or the chicken that you're eating. So you can get iron from plants, but just understand better sources are going to be those animal sources. So we recommend having a good variety of both in the diet. Iron absorption can also be inhibited by calcium. So we'll talk about calcium here in a little bit, but keep that in mind. So if you're eating a lot of calcium-rich foods alongside iron-rich foods, you may not absorb as much iron or calcium because they kind of compete for absorption. A lot of times providers will ask that you separate iron supplements from calcium supplements if you're on both, at least by 2 hours, to help promote that absorption. Another thing that can affect iron absorption if you're on a supplement or even eating an iron-rich food is coffee, tea, or caffeine consumption. That decreases your body's ability to absorb iron correctly. So you want to try to avoid those things. Vitamin C rich foods like your citrus fruits, for instance, those can actually help your body to absorb iron better. So maybe having something like that along a iron rich food, and that will allow your body to really utilize that nutrient better. Again, iron can come in a variety of forms. You can find them in multivitamin supplements. They also come in, like I mentioned earlier, different forms in those supplements. So ferrous sulfate, ferrous gluconate, ferric citrate, ferric sulfate. And then you could have chelated versions, which can be easier to tolerate. Ferrous iron is going to be better than ferric iron because ferrous iron is that active form that our body wants. So when you're looking at supplements, if you find ferrous, most likely that's going to be easier for you to absorb. However, if you just don't tolerate iron, a chelated iron may be better too, and that would be indicated on the back of the supplement, how it's formed. People at risk for iron deficiency are pregnant women, young children, anyone who's had blood loss. So if you have a GI bleed or a significant injury or trauma and you lost a lot of blood, you could be at risk for iron deficiency. People who've had cancer, undergoing chemotherapy, a lot of times their iron levels are low. So you may have had a history of that, or if you have any type of gastrointestinal surgery or even heart failure, you could be at risk for an iron deficiency. Recommended dietary allowance for individuals who need iron is 8 to 18 milligrams a day, depending on your sex. And then for individuals over 50, it's usually just 8 milligrams a day. You don't want to do too much iron because it can, like I mentioned, cause a lot of GI intolerance or side effects. So you just might feel more constipated or have more abdominal bloating and pain. So it's really important not to overdo it with iron supplements. It's best if you need extra iron to do what's recommended by your provider, but also just get a well-rounded diet that consists of iron foods, which is way easier to tolerate. We're gonna look at calcium. It's actually the most abundant mineral found in the body. Approximately 98% of our calcium resides in our bones and our teeth. So calcium and vitamin D play a role together, and they are usually paired together. We need calcium to keep our tissue strong and to help withstand the impact of our weight. Calcium also helps with blood vessel dilation and contraction. So when you think about blood flow, your blood pressure, calcium plays a huge role in that. It helps with clotting, so blood clotting, nerve signaling, and hormone creation. So our body's ability to make hormones, again, requires this mineral. Calcium is most abundantly found in dairy foods, along with leafy greens and fortified cereals. You can also have orange juice that's fortified with both calcium and vitamin D. So if you're low in one or the other, you could have some orange juice, and that would give you a little bit extra of both. Other good sources would be your soy products, tofu, if you can eat those, and then spinach, turnip greens, kale, broccoli. Those are great sources of calcium that people don't normally think about. Seeds, even like chia seeds, those are a great source of calcium too. If you're taking calcium carbonate supplements, you'll want to take with food. So there's an increased production of stomach acid to help absorb that version of calcium. If you take citrate, calcium citrate, you don't necessarily have to take it with food. So that's just something to consider if you're taking a calcium supplement. So look at the multivitamin and see what form it is, because that would definitely help the way you feel if you're taking it with food. You won't feel as nauseous or have discomfort like you could if you took it without food. People at risk are going to be those with a vitamin D deficiency. So if your vitamin D is borderline low, your calcium may be a little low too. If you have impaired thyroid function, you could be at risk for calcium deficiency. If you have impaired bone reabsorption of calcium, anyone who's been critically ill, or if you're taking any type of bisphosphonate, or if you're on chemotherapy such as cisplatin, or if you're on proton pump inhibitors, you could be at risk for a calcium deficiency. A lot of times doctors will recommend, if you need to be on calcium, they'll say, hey, just take some Tums, because it is calcium carbonate. So you could take that. But there's other forms of supplements out there. A lot of times they're in 500 milligram tabs. And if you're deficient, they'll say take 1500, 1200 milligrams a day to help replete that. Most people just need to have 1000 to 1200 milligrams a day, and you could easily get that from your diet if you're consuming good calcium sources daily. Magnesium is a very popular supplement and mineral out there right now. What it does is it plays a role in a lot of bodily functions. It is used in so many different enzyme functions. So with muscle function, protein synthesis, nerve control, it helps with blood glucose control, blood pressure control. So magnesium is needed for a lot of different functions in the body. It helps with energy production, so your body's ability to convert food into energy to use. It helps with making bone, DNA, RNA. It can help make certain antioxidants in your body, like glutathione is made in your body, so it helps with that. And then it helps with electrolyte balance as well. So when you think about muscle contractions, like if you've ever had a Charlie horse or a muscle spasm, sometimes if you're low in magnesium, those can happen. So, magnesium's, it's definitely really important. You can get magnesium through a lot of different foods, but some top contributors are going to be your seeds and nuts. So pumpkin, chia seeds, different nuts like macadamia nuts, Brazil nuts are a great source of magnesium. Spinach, you can get magnesium from beans, some milk, fish, chicken, beef, and sometimes in fortified cereals and oatmeals, they'll have extra magnesium. Magnesium comes in all kinds of forms. I'm sure you've heard some forms are better for certain conditions. Like I think right now the rave is taking magnesium to help with relaxation. I know some people are like, I've tried magnesium lotions and bath salts and it can help relax you. It also can be used as a laxative. So if you're constipated, sometimes providers will recommend magnesium oxide. It can also help with heartburn or indigestion. Magnesium taurate can be used to help with blood pressure and promote blood sugar concentration. So there's different versions out there. Usually for deficiency and repletion, it's mag citrate that's recommended. If you have any type of high fluid output, so let's say you have an ostomy, or if you have a wound, or you're having a lot of diarrhea and vomiting, you could be at risk for magnesium deficiency. So that's why we're always recommending people to drink electrolyte-rich beverages that contain magnesium, and that can help prevent dehydration. If you've had recent surgery, that can put you at risk. If you're a diabetic, if you're an alcoholic or have a history of alcoholism, you could be at risk for magnesium deficiency. Or if you use diuretics or on proton pump inhibitors, you may be at risk. The RDA for magnesium is 420 milligrams per day and for males and 320 per day for females. It's really important if you do end up taking magnesium that you don't go over those levels, because sometimes taking too much magnesium can lead to issues like diarrhea, especially if you're trying to use magnesium to prevent diarrhea and uropleeding. You don't want to overdo it with that because it can cause some side effects. Some other miscellaneous supplements that are out there that I wanted to hit on real quick. Probiotics, they can be helpful if you've been on antibiotics or you have a recent viral infection, if you have IBS or reflux. There's a lot of research out there that promote the use of probiotics. You would want to talk to your provider to determine which would be best for you depending upon why you want to take it. You can also get probiotics in some foods like yogurt, kimchi, kefir, kombucha. Those are all probiotic sources. Herbal supplements are kind of on the rave. They're generally safe, but a lot of times if you're in active treatment, you would want to reduce those and probably avoid them. You definitely want to let a pharmacist or a doctor know if you're taking herbal supplements, because sometimes they can interact with certain medications. They can interact with chemotherapy treatment if you are on active treatment. So having that clear communication is crucial if you are taking those. Protein supplements and collagen, those are helpful to help promote wound healing or tissue growth. They can help improve muscle mass. A lot of times we do recommend protein supplements for people, especially if they've lost weight or have a history of malnutrition where they lost a lot of muscle. Those are very helpful in helping to replenish and rebuild that tissue. If you have certain diseases like kidney disease, for instance, you would want to talk to a dietitian or a doctor about protein supplements because you don't want to overload your kidneys. So just something to think about if you have kidney disease. Omega-3s are another supplement. They're a great source of anti-inflammatory fats that promote immune function. They can also help with heart health, like lowering cholesterol levels, improving heart health. They're generally safe, so omega-3s are great. You can also just get them in those heart healthy fats like olive oil or fish even. They have good source of omega-3s. So getting some good sources of those fats in your diet can help get those too. Now we're going to kind of talk more about diet and how you can get all of those nutrients I just said into your diet regularly. And dietitians, they're all about the plant-based diet. So that's just focusing on a diet that is rich in whole grains, your nuts and seeds, your vegetables, fruits, and different herbs and spices. Does not mean you're a vegan or a vegetarian, but we do want to place that emphasis on getting a well-rounded plate consisting of these plant foods. There's different options out there. So when we say plant-based, like I mentioned, it doesn't necessarily mean vegan or vegetarian. You could be a flexitarian or you can be a pescatarian. Most people are going to fall into this category where they eat a little bit of everything, but they really emphasize the importance of getting those plant foods, like I mentioned earlier. So you could still have a small amount of beef or meat in your diet, fish and chicken, and still get that plant-based diet if you're really emphasizing your intake of fruits and vegetables and whole grains in your diet. Plant-based diets allow us to get plenty of fiber, and also provides a wide array of those vitamins and minerals that I went over. There's also a different category of nutrients known as phytochemicals. So those are more of like your antioxidants that can help prevent aging. They can help reduce cancer risk. So it's important to get all of that from your diet. You're getting so much more than when you eat the food versus when you take a supplement. You're getting all of these things together. It helps to lower your risk of heart disease, type 2 diabetes, and cancer. And then people who follow vegetarian or vegan diets typically weigh less than non-vegetarians. So if you're, we want to make sure that if you already are malnourished, that you are trying to get a balanced diet. So you're including good sources of protein to prevent your malnutrition from worsening. So just key things to think about when you're talking about diet. With reducing cancer risk, diets focused on plant foods can reduce the overall risk of cancer and reoccurrence. Like I mentioned, the phytonutrients, they protect our cells in the body from damage that can lead to cancer. You want to aim for at least 2/3 of your plate to be plant foods, so that way it's that traditional plant-based diet. And it can also help with weight management. So if you are overweight or obese, following more of a plant-based diet can help reduce weight and get you in a healthier state. And you will meet your needs if you follow a plant-based diet. You'll get plenty of calcium through the foods that I mentioned. You'll get plenty of iron if you're getting these sources. Again, like I mentioned, plant foods are sometimes not as absorbed as animal sources. So keep that in mind if you're at risk for iron deficiency. You can also get good sources of zinc and B12. Those are common nutrients that are found in animal products, but you can also find them in plant foods as well. This is just a picture of what my plate could look like, or the plate that I mentioned earlier. It's called the New American Plate. There's different versions out there, but you can see here that at least 2/3 of the plate, or even really 3/4 of the plate, it consists of plant-based foods. So like you have a whole grain there, you have your broccoli and then your carrots, and then you have a lean piece of protein. So that's kind of a picture of how that could look. There's some tips on how to meal plan for plant-based diet. You want to try to aim to reach the recommended 5 to 7 servings a day of fruits and vegetables. So starting with your breakfast meal, figuring out ways to incorporate at least 1 or 2 of those could help you get in the amount that you need. You include that at your snacks, at your lunch and your dinner. You should be meeting that recommendation. Making sure you're getting a healthy protein with every meal is crucial. So, you could do seafood at least twice a week. You could try meatless proteins, like lentils are a great source of protein. Quinoa has protein in it. Different beans are a great source of protein. So you could get those in your diet if you're looking to try to limit meat in your diet. You really want to reduce processed meats and consumption of red meats. So if you're going to have like a steak or beef, maybe just 2 days a week would be ideal. Fast foods and other foods that are high in fat, starches, or sugars are usually not micronutrient rich. So trying to reduce those can also help. And then you want to limit sugar sweetened beverages and alcohol consumption. Alcohol can actually inhibit absorption of a lot of nutrients. So that's one that we really want to try to avoid.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.